This video is looking at temporomandibular joint disorders, or TMJs, and massage. TMJ disorders are problems with the joint between the lower jaw and the base of the skull. There are two temporomandibular joints, one each side of the jaw, which allow the mouth to open and close. It's a gliding joint. And there are two types of TMJ disorders, muscle and joint. Sometimes it's both. None of this is a serious condition in terms of being a threat to life, but it can have a serious impact on health and well-being, and it's something that will impact on 20 to 30% of the population at some point in their life. Muscle-related problems are more commonly caused by clenching the jaw and nighttime teeth grinding, which overworks the jaw muscles and puts the joint under pressure. Joint-related problems are usually degenerative joint disease, dislocations, or infections. How to tell a difference? When it's a joint issue, you can sometimes hear a popping or a clicking in the jaw joint. The jaw might lock, and there can be pain at the side of the jaw, usually just on one side, and headaches. Muscular-based problems will lead to pain on both sides, headaches, and a difficulty in opening and closing the mouth. For both forms, you can also get pain in the shoulders, back, neck, tinnitus, which are ringing in the ears, dizziness, blurred or double vision, vertigo and nausea, hearing problems, and pain in front of the ears. Treatments include medication, mouth guards, splints, surgery, even for some joint replacements, but we can also make a significant impact with massage. In terms of contraindications, if your client has dentures, they need to be removed before treatment. If your client's had recent dental surgery, just wait until everything's fully healed before treatment. We're going to demonstrate some specific moves to do to relieve this painful jaw condition. It's nice to return to the head work after completing the jaw work. It's not the most comfortable move, but it is very effective. Okay, so let's look at the TMJ practical work. We're going to start by, I just prefer to use lotion, just applying a little bit of oil or lotion across the eyebrows. I think it's nicer to use the lotion because it just means that your client's not going away feeling greasy. At the moment, I'm just applying that. And then I'm going to do a slightly deeper sweep across the eyebrows. You can either do both together, particularly when you're just warming up, you're just starting it. You can see it's enough to move the skin, but I'm not pressing too deeply. It's a very delicate area. I'm being very careful that I don't come forward onto the eyes. You will feel the eye socket there, so you're very much following that. Particularly if you're working with a lady who might have had eyebrows either tattooed on or has plucked eyebrows to almost non-existence, you'll have to feel for the eye socket. You can't go by where the eyebrows are. Sometimes where the eyebrows are isn't naturally where the eyebrows would be. So feel for the eye socket and you're working along that. You can see I'm just sliding along to begin with. You can then, I'm going to kind of anchor this eyebrow here. I'm going to press and release all the way along. It's surprising how tender the eyebrows can be in someone who has got TMJ problems or who's gritting and grinding their teeth. And I'm bringing that all the way out to in front of the ear. And I'm going to repeat it on the other side. You may not be able to see this as easily, but you can see how I'm just anchoring with that first thumb and working my way across. It's just a few millimeters at a time that I'm working. When I get to the temple, I'm just gliding. I'll show you again on this side. So I'm working across just a few millimeters at a time. But as I get out towards the temple, I'm not putting any pressure on. I'm just gliding out towards the ear. You're then going to use your 3 middle fingers, and we're working all the area in front of the ear. So in front of the ear and above the jaw. And you'll start to feel when you get to here, you can feel the jaw joint that we're going to come back to. We're working up until we get to the auricularis superior, which is the thin fan-shaped muscle. And I'm slowly circling. I'm going to come in both directions. So you can either work up all together in one direction, right across, and then come back and work in the other direction. Or you can just alternate as you work, so you can go in one direction and then back across in the other direction. It doesn't really matter so long as you're doing that work. So you're working all the way from around the jaw, up in front of the ear, and then across to the top of the ear. And then we're going to do what is possibly the meanest thing that we do within this area of massage, which is the jaw release. It's one of those things that you can describe as kind of a good pain. At the time it's been done, it's quite intense, but I will always talk my client through it that I'm going to hold that spot for no more than 3 seconds, and I will count those 3 seconds so the client knows. It does smart, the client will know it's been done. Nobody will sleep through this bit of the treatment. It smarts then for maybe about 20 seconds. It's not unusual to see the client kind of opening their jaw and moving it from side to side a little bit after you've done this, because it is tender, but it will settle within 30 to 40 seconds and they will feel the instant relief all the way up here. So to find that spot, we're working up from the jaw. You'll feel the edge of the jawbone and you're coming to the jaw joint, and I'm going to ask Gordon just to open and close his mouth very slightly, and as you do, you will feel, the reason you ask your client to do that, if you could just repeat that 2 or 3 more times for me, Gordon, is that you'll feel that jaw joint move. And I'm coming not right inside the jaw joint so that I'm between the teeth, but just on the inside edge of it. I tend to find it with my fingers, and then I'll put my thumbs on because I need that depth of pressure that I'm only going to get from my thumbs. I'm then going to ask Gordon just to relax his mouth so it's open slightly. That lets me double check I'm in the right place. And if you could just keep it open for me, Gordon. And then take a nice deep in breath, and I'm going to go in on the out breath. Now this is where I always say I will only hold this for 3 seconds, and I'm going to count those seconds. So on your next out breath, and I am just pressing and holding, and I'm pressing quite tight, up to 2, 3, and releasing. And then you can do some gentle circles around. It is a painful move. Practice it on yourself first. Practice finding that point in your jaw where you can feel the joint open and close. And if that's the joint, you're working just on the inside of the joint. Practice so that you know you've got your depth right. Practice on somebody who doesn't mind being practiced on, so that once you've mastered it on yourself, you can practice on somebody else. It is perhaps one of the most tender areas that we do, but it's incredibly, incredibly effective.